Good morning and welcome to Hawaii Matters. I'm Devin and I'm the host for this morning's show. We'd like to welcome in Dr. Mason Turner all the way from Maui. He is a psychiatrist with Kaiser Permanente and here to talk about holiday blues and depression. How you doing, Doc?
Good. Thanks for having me today.
Do we do it Dr. Turner, Dr. Mason? Is there a way you prefer me to refer to you?
Dr. Turner, Mason. Mason's my first name. So,
okay.
Yeah.
Okay. So we'll go with Dr. Turner?
Sure.
Okay.
Sure.
But I can interchange him if I need to?
If you need to, yeah.
Okay. Just to make sure.
Everyone does. Don't worry. Don't worry. Everyone does.
So, Dr. Turner, it's nice to have you here from Maui at Kaiser Permanente. So, how did we manage to get you here?
Oh, well, this is a very important topic to me, so I wanted to make sure to spend some time talking about how to manage stress, particularly during the holidays.
And you've been working with Kaiser Permanente for how long now?
So I've been with Kaiser Permanente a little bit over 16 years, both in Northern California and here in Hawaii as well.
Wow. What got you to come over to Maui? Well, besides the obvious thing of being in Hawaii.
Right. Who doesn't want to live in Maui,
Exactly, right?
Yeah, it's really nice for your stress management to live in Maui, that's for sure.
All right. So can I get a little bit of background? I mean, where did you get your degree from, matriculate from, all that kind of stuff?
Sure. So I got my medical degree at the University of Texas Southwestern Medical Center in Dallas, Texas, and then did my residency training at Harvard Medical School, Massachusetts General Hospital, and McLean Hospitals. And I am board certified in both adult psychiatry and in addiction medicine as well.
Wow. Now, when we're talking about holiday blues and depression, how would you define that for somebody?
So I think, first of all, it's important to keep in mind that anyone who actually goes through the holidays is going to have some degree of stress. We have more parties to go to, gifts to buy, decorations to put up in the house, things of that nature. So by its very nature, kind of coming through the holidays is really going to create some situations that are unique and novel for us. Many of those are good, but some of them also just create more stress and more impingements on our time.
So would you say that the holidays themselves are the common cause for the holiday blues? Just because you're going, oh my gosh, there's too much to do.
That's right. So that's part of it. The other part is that oftentimes we can have almost unrealistic expectations of how we're supposed to behave during the holidays, which friends we're supposed to see, which family members we should be spending time with. And sometimes if we don't actually meet those expectations, we can become kind of depressed or feel like we're not doing what we should be doing in our lives.
So what are some of the coping mechanisms you suggest for people to try doing during this time?
So first of all, I always tell people, think about the holidays for what they are. They're a time to spend your time with family, with friends, to enjoy reflecting on the end of the year, where you've been this current year, where you're going next year, and really think about what the holidays are really for. The holidays are a time to get together and see people, but we don't want to flood ourselves with trying to get to every single holiday party, buy gifts for every single friend or family member that we encounter. We really want to think about what the holidays are for and what positive aspects of the holidays that we can pull from that. So that's first and foremost, we want to think about how we reduce our stress during the holidays.
Okay.
I also really advise people take a hard look at things like your budget. Do you have enough money to buy all of the gifts that you want to buy, or can you scale back in some ways? Can you make some gifts? Can you do something that's very novel for a friend or family member that doesn't cost a lot of money? And then finally, it's very, very important to have realistic expectations about your time, and really going back to what is important for you during this holiday season.
You know, it brings to mind a friend of mine for Thanksgiving. He and his husband were saying, you know what, we're just spending Thanksgiving together. It's going to be just the two of us. They said usually we're the ones who have to either go to each party or we host a giant party ourselves, and it's just too much this year. And I was actually kind of impressed, but sometimes I wonder if that causes you more stress, you know, trying to having to explain to people that it's going to be a thing of just the two of you, or you know, your family just celebrating that holiday together, as opposed to making it this gigantic thing. And I don't know what's more stressful.
It's a very good question, because I think especially when you have something that's like an annual recurring tradition,
Right.
That's a big party or an event or something, people can start to think about, well, why is he not holding that this year? Or, you know, even just telling the 50 or 100 or 200 people you invite to this event that you're not doing it can be very stressful as well. But again, it comes back to recognizing your limitations and really understanding your expectations and what you can deliver with those expectations. I was reminded of a friend of mine recently who would host these big gatherings for 150, 200 people, kind of immediate family members, right? So really small family.
150 immediate family
there you
members?
go, right?
Oh my God.
Something like 20 kids were in the family. And so I was reminded that she would actually hold an event both Thanksgiving, Christmas, and then would also do New Year's Eve and a New Year's Day event. And so I remember having a conversation with her saying, that's really, I don't think people expect you to do that. I think maybe you need to look at how much time, effort, and energy it's taking you and thinking about kind of scaling back on that a little bit. Took her a couple years to decide she was going to scale back on one of them, and she dropped the New Year's Eve party, and she said, nobody noticed. Nobody picked it up. Nobody even paid attention because there was Thanksgiving and Christmas also kind of that she was there hosting. So it was something she really wrestled with, but at the end of the day, really saved her a lot of time, which I think was very important for her.
That's funny that it happens that way.
Yeah.
Right? That you put so much emphasis and so much, so much stress on yourself about these things that are happening. And when you just don't do them, people go, I guess we'll just go find something else to do.
That's right. And I think lots of times it's because we put the pressure on ourselves. And most people that we know and care about, if you actually say to them, hey, I've got a lot of stuff going on, I'm really feeling pretty stressed this year, whatever it is that's going on for you personally, most people say, oh, yeah, I understand that. I get it, and let's maybe next year, you can do the party next year. So I think lots of times it's coming from internally when we worry about these things more than from other people around us.
And some of that, is the idea to just have a conversation with yourself and just go, hey, just relax. It's okay. Don't worry about it.
That's right. And I think also going back to the fact that we need to really center ourselves on what's important to us during the holidays. Now, if what's important is to throw this big, huge Thanksgiving dinner for 200 people, great. Then you want to put your energies there and make sure you do that the best way you possibly can. But oftentimes, it's really about saying, what do we want to accomplish in this holiday season? Why is it that we're celebrating, and kind of getting back to really those basics and then build from there. And oftentimes you'll find that alignment between what you want out of the season and what you're able to do, plan, and deliver upon, when those things are aligned, you really feel a lot better.
We're here with Dr. Mason Turner. He is a psychiatrist from Maui, Kaiser Permanente. He's joining us this morning. We're talking about holiday blues and depression. And, one of the other things, too, is sometimes it's about having people come into your life and celebrating with 150 people. And sometimes it's deciding who to go and see. How much pressure do people place on on themselves and I guess their partners every year? Because you'll have these couples that have sort of just gotten together, right? And then all of a sudden, especially because it's Hawaii, my family first, your family first. I mean, how is there a way that you help people sort of figure that kind of stuff out? Because it can get really stressful because people have expectations of you.
That's right. And I think sometimes the family expectations are really, really difficult to manage, particularly here in Hawaii, where we're very family-centered, and really trying to understand how you balance all of the needs of your various family members can be really challenging. And there are various ways you can go about that, but I always remind people as well that they need to save some time for themselves. So the holiday season shouldn't just be about shuttling between various family members and forgetting about your own family needing its own time together. And so you want to really think about that being in the mix as well. And there are a variety of different ways you approach this, but I think it comes back to saying to your mom, to my mom, whoever mom it is that we need to talk to say, you know what, really this season we're really busy. We have a lot of stuff going on. We're going to need to kind of figure out how we make all this stuff work together. Those are not easy conversations, but they're really important because then our stress level will go down once that's all kind of resolved.
Very nice. All right. Now, we're talking about holiday blues. How would you differentiate between holiday blues and depression?
Very important question, because I think to a certain degree, many of us will experience some holiday blues, maybe feel a little bit depressed, a little bit down and sad, during the holidays or after the holidays, that kind of thing. That's pretty common. However, a full-blown clinical depression is a very, very different illness. And actually something that we know probably around 15% of people throughout their lifetimes will experience clinical depression. And oftentimes it can be triggered by events in our lives that are very stressful, such as the holidays. And a lot of people with depression find the holidays to be very difficult because of the expectations that are maybe being placed on them as well. So we do see depression flare up during the holidays with some frequency. And that's a very different type of picture where we really are seeing more physical symptoms of depression, much longer lasting and more constant. So we kind of think about clinical depression as being the presence of depressive symptoms for at least 2 weeks, typically more, and accompanied by some severe physical symptoms such as problems with your appetite, difficulty sleeping, poor energy, really not getting enjoyment out of life, and those kinds of things. And those are really indications that you need to seek professional help to get that taken care of.
And would you recommend going once a week, twice a week? Is there even a limit that you put on this thing, or is it just you really need to just go see somebody?
We always start by seeing someone and doing an evaluation to figure out what is the appropriate treatment. And we know for depression there are a number of different treatments. We have medications, we have psychotherapy, self-care strategies, even stress management is part of a good depression care. So we know there are various different ways to address depression, but people who are feeling depressed shouldn't feel alone. They should know that there are resources that are out there to help them, and they really help to guide them in terms of what the next best steps in treatment would be.
So if I have a friend of mine who's feeling, I have a number of friends who've lost their loved ones, their family members, parents, whatnot, and the holidays get very stressful for them. I'm noticing. A lot of them are just sort of thinking, wow, my first Christmas without, my first Thanksgiving without. And those are kind of tough things to walk people through. As a person who's a layman who doesn't have any training in that, is there something that we can do to help somebody who seems to be going through that?
Yes, I think as a friend or a family member or someone that you're interacting with who has depression, there are a couple of really important things you can say to that person to really help them. One, it's always important to emphasize that there is help out there, because a lot of people with depression feel very hopeless and feel like they're never going to get better and that no one can ever help them. And so as someone, either if you've had your own experiences with depression or if you know people who have, really just indicating to that person, hey, you can get through this and there's help out there to help you with that. I think that message is really, really important. Depression and treatments for really any psychiatric disorders still remain very stigmatized. And people with depression can feel a lot of stigma and really feel like that they can't even talk to anybody about what's going on for them. So it's really important to emphasize that there is treatment, there's hope, there are ways to get through it. And I think the other thing is just to say, hey, I'm here for you. When you want to talk about it, if you want to talk about it, sometimes just sitting with someone who's depressed and being in the room with them so they feel like they're not alone can be helpful. So really those types of very basic and simple interventions can be very, very useful.
One other thing, too, is some people, when they're depressed, they seem to be, or at least I've had a couple of friends who are depressed, but they seem almost manic. They end up being so busy and doing so many things, but they're actually really, really sad. They're out there and being happy and all this stuff, but then, I don't know, you read their Facebook posts and you go, wow, they're really sad. And I don't know. I'm wondering if you can help me sort of figure it out, because some people are feeling it stronger than others, I guess. I don't know if I'm even making any sense. I've got a couple of friends who are like that. They're very much out there and friendly and happy-go-lucky. And, you see them and you go, oh, wow, they're doing so good. They're just really enjoying the holidays. But then you see a Facebook post that says, oh, it's so sad when people, don't come through for you. And this time of year is so bad. And you go, wait a second. And so there's you know what I mean? There's such a difference. There's such a contrast that sometimes I'm not sure what to do for them. I mean, other than giving them a number or giving them a website to go to and telling them, hey, I'm here for you. And they say, no, I'm okay. I go, I want to go. No, you're kind of really not. Well, I want to help them, but I don't know how.
I think the first thing that's important to keep in mind with these types of situations is that while we talk about clinical depression that I was speaking about earlier, that is a symptom of other psychiatric disorders as well, including things like bipolar disorder and some other different disorders as well. They really require the intervention of a professional to sort out what the diagnosis is and the best treatment. So I think, again, the message is, I think you would probably benefit from seeing somebody to do an evaluation, to really sort out what's going on, sharing your observations, because maybe that person doesn't have a lot of insight about how they're coming across or what they're communicating. Maybe they don't even understand it themselves, and that kind of thing. So I think just those kind of objective observations can be useful. With one caveat, sometimes people don't want to hear from another person about their own, experience, right? So you have to be kind of careful with that. But I think also it's important to just say, hey, do you want to talk about something? This is kind of what I noticed. I'd love to sit down and chat with you about it. If you really feel like you don't need my help right now, great, but I'm here for you if you need it in the future. Those kinds of messages that I can be here for you anytime that you need to talk to me can be very helpful and very useful.
And how do we get people beyond the stigma that they feel about seeing somebody professional? I mean, I go and see a therapist. I think it's a great idea. I have absolutely no problem with telling people that I go and see a therapist. But I know that there's some people who say, I don't want to go because they're worried about how they're going to be perceived. Or they said that I've gone to somebody, but I didn't like the person. And so they assume that if they get sent to that one person, that's the only person they can go see. And that everybody that does this particular line of work, they're all the same, which is not true, right?
Correct. That's not true.
Yeah.
I mean, just as with any medical field, there are different providers, different approaches, and particularly with therapists who may be trained in different ways of delivering therapy and even the type of therapy they deliver. It's important not to be discouraged if you can't find a good fit initially, and to continue to kind of look for therapists. Sometimes with medications as well, you have to try multiple medications before you land on the one that's right for you. So I tell patients that getting psychiatric treatment sometimes can be a very frustrating experience because we don't have a blood test. We don't have a way of telling for sure, okay, this is the type of therapy that you need. This is the type of medication you need. And so oftentimes it is about interviewing or visiting with multiple different people, trying to understand what's the best fit for you as a person. And that can be very, very useful.
Is depression hereditary at all?
So depression does have hereditary components. It's not exactly a fully genetic illness because we do know some people develop depression who have no family history of depression, but there is a family component of that. So if depression runs through your family, there is a chance that you will get depression as well.
And when should people seek professional help with depression? Just if you know that does somebody else spot it for you? Do you just sit there going, it's just way too much?
So I think that it's always important for people with depression to seek help in some sort, to either get an evaluation to determine which treatments would be best for them, to sit down and talk with a therapist. Sometimes all you need are a session or two to really understand what are some of the tricks that I need to learn, what are some of the ways I need to learn to manage my depression, that kind of thing. And so that can be very important, I think, for pretty much anyone with depression. There are some red flags that we think about. If those are going on, you really want to seek treatment really quickly and almost emergently in some cases. If you're feeling suicidal, you're feeling like harming yourself, or if you have harmed yourself, that's a reason you need to get in to seek help emergently. Go into the emergency room, seek help as quickly as you can. If you're noticing that substance use is getting out of control, your drinking is getting out of control, or your drug use is really getting out of control, another sign that your brain is telling you, I really need some help and I really need some treatment to get better. But I think really most people with clinical depression can use some assistance and some treatment.
Once again, we are speaking holiday blues and depression with Dr. Mason Turner. He is a psychiatrist with Kaiser Permanente on Maui. Now, Hawaii is a special place, but is there anything in particular about the holidays that relate to local life here? I mean, do you find anything that's a little bit different? Do we experience some things differently that put us into this holiday blues depression thing?
Well, I can speak from my experience working on Maui. Certainly we see some differences there with the holidays because we have, as on Oahu as well, we have a lot of people who have moved to Hawaii from the mainland or from even other countries. And Hawaii is relatively geographically isolated, as we all know. And so getting back to see your family during the holidays can be very difficult when you live here in Hawaii. And so if you are separated from your family by thousands of miles, that really can take a toll on you. Now, the flip side of that is that I do find people that are living away from their families, they tend to develop communities themselves and really look out for one another. So one of the things I love about living in Hawaii, people take care of each other. They really look out for you and they really reach out to you when you're struggling. So I think that there's kind of two sides of that coin, as it were. I will say that I think stigma issues around mental health are a little bit different here in Hawaii than some other places in the United States. But we see that in many different areas where stigma around mental health is something we fight on a daily basis, whether it's here in Hawaii or anywhere else.
Is it worse here in Hawaii? I mean, is the stigma worse? Is it better? Or are we getting better with it?
I think we're getting better with it. But there are some people that I work with that are heavily stigmatized around seeking mental health treatment. And so for them to see a psychiatrist is a really big deal. They might see a physician, their primary care physician, for example, and take antidepressants, but they would never come in to see a psychiatrist because of the stigma attached to that. So we really try to meet people where they are and try to understand what is the best way to get the best treatments delivered to that person and try to be innovative around how we do that.
As far as the treatment options, you mentioned psychotherapy. I think people have maybe a misconception of what that is. Everyone thinks psychotherapy, and they think either you're lying on a couch or they've got stuff on your head or things are happening, and I don't think that's exactly correct. So could we detail that just a little bit?
Yeah, what's really funny, actually, all of our offices in Maui have couches in them, which I find kind of interesting that all the psychiatrists have couches. But indeed, psychotherapy is not laying on a couch, at least not for the most part. Some therapists still do that, but that's not the primary means of delivering psychotherapy. The best way to think about psychotherapy is that you're learning skills to be able to deal with your depression or with your anxiety, while you're also getting some supportive help from a therapist who can kind of challenge your thinking and help you to think about different ways to solve and approach a problem. And that comes in many different ways and formats. It can be individual weekly treatment, it can be group treatment, it can be periodic check-ins every 4 to 6 weeks even. There are various ways that psychotherapy kind of shows up in our society these days, and none of them are right or wrong. It just depends on how it works for you and how it works for the individual. But yes, there's still a lot of misconceptions about therapy, and we try to dispel those and really say, look, this is about building skills. It's not about going back to when you were 5 years old and your parents divorced. It could be, but that's not always what happens. It's really more about how you learn skills to deal with your depression and anxiety.
How did that happen? How did it become that? Well, I mean, how did this stigma get created? That's the part I don't understand, because we're social animals generally, so we like to talk to each other and see how each other is doing. So the fact that you don't want to go see somebody professionally who actually, one of the things I like is that, you're professionally trained to hear me talk about all the stuff that's wrong. And you help me sort of navigate it and figure out the best way to handle it. So it seems to me that would be something that everybody would want to do, right?
Right, and I think somewhat the stigma comes from the fact that people have this misconception that if you just work hard enough or if you have a strong enough character, you won't suffer from depression and anxiety disorders, right? So if you're a strong enough person, you wouldn't have these issues. We know that is a complete myth, that depression and anxiety are biochemical issues in your brain, and we can address them biochemically. Even psychotherapy has been shown to alter the biochemistry in your brain for the better to actually improve your depression and anxiety. So we know these are biochemical issues. They're medical illnesses, and the strength of character and just kind of pushing through it, those types of things really don't help. They help in some situations, but they're not going to be the solution to the problem. We think about it very much like diabetes, for example. Diabetes is a chronic illness. You have to learn ways of managing that illness by taking your medications, engaging in lifestyle modifications, looking at your diet, things of that nature, right? Depression and anxiety treatment, very similar. You're looking at lifestyle modifications, ways of changing your ways of thinking, exercising more, watching your diet, using medications that are prescribed. And so it's really very holistic treatment in the same way that, say, diabetes treatment is. And when I think about it in those terms, it helps to really erase some of that stigma that I'm a weak person because I have depression. That's not true at all. You have depression. It's a biochemical illness that we can then help you correct through various mechanisms.
Well, I'll say that some of it is also due to the fact that, I don't know if it's because I'm Asian, but, we have a large group here that are, plantation workers and people who came in from Japan or China or whatever. And it's just something you don't talk about. I know with regards to guys in the 442, there are heroes, and, the all Japanese regiment who fought in World War II and saw these horrors of war, and then they came back and they just kind of went about their business, and they just never ever talked about it. And they passed that down to my parents, who've kind of passed it down to me. And I don't even know that it's a male thing so much as it's just you don't deal with it. But it backs up. The interesting thing is it backs up on you in some other way or some other fashion every single time, right?
That's right. And so it's very important. I think the idea that you're getting at is that there's this idea that if we work hard enough and kind of try to forget about our problems, they're going to go away, or we just kind of push through and try to make sure that we're staying active and trying to distract ourselves and that kind of thing. That's a component, a technique of dealing with depression and anxiety, but it's not the best way of managing it. We really want to get down to learning those skills to deal with the feelings, trying to understand how our thoughts, feelings, and behaviors intersect, right? And that can be taught in the course of psychotherapy. And then we also want to correct those biochemical imbalances with medications where that's appropriate, right? So we really have to look at the problem. Kind of denying that the problem exists or that it's not creating issues for us will actually ultimately compound it and make it worse in the long run.
Just for example, I mean, is there some small thing that you can help somebody with if they're feeling stressed about, I don't know, if they're a person that has to go out and talk to people all the time. Some people are, they call themselves extroverted introverts or something like that. Have you heard of this?
I have, yes.
Right, and I went, what does that mean? And, you know, some of them feel like they have to recharge at home or get, I mean, I don't know. Sorry, I'm dancing a little bit because I'm trying to figure out how exactly to express it. But it didn't make any sense to me. But I think it's because I'm an extrovert by nature. But is there a trick that they learn? Because when I see somebody who considers himself an extroverted introvert, I don't get it. I don't understand what they mean. And when they're feeling too stressed out to even meet with people, I don't know how to help them because they just sit there going, I can, and I go, I don't know what to do for you other than go see somebody. But in that moment, is there a trick they should try to think, something they need to envision? I really don't know.
So I think one of the ways to approach that particular question is to really go back to how is the symptom, let's take depression, for example, how is that affecting your life, and how would you want to change in order for it not to affect your life, right? So in this particular example, maybe that person is staying at home out of fear of being in social situations, which is making the problem worse, right?
See, you said it so much clearer than I just did. I'm sorry.
No, I think I understand where you're going with that, because I think sometimes people feel like they're addressing the problem when in fact they're making it worse. So I always come back to the fact, like, what is the problem that we're trying to solve? What is the functional impact that this is creating in your life? And then let's walk it back and see if we can figure out how to solve the problem. So to take this example, maybe the problem is the person feels like they're so anxious in a social situation that they don't want to go to a party, or they don't want to even be around people. So they then stay at home to avoid the situation. Well, the problem is really they want to be out there socializing, but they're too anxious to be able to do that. So let's work on that part of the problem and try to see the goal as being getting that person to engage more socially. It's oftentimes, that's the conversation I have with people to say, let's not look at the way you're managing it right now. Let's look at what you would like for the future state to be. Keeping in mind as well that we're individuals and we have to find what works best for us, because what works best for me may not work as well for you. And we have to understand those differences and really try to figure out how we help each individual person.
That's interesting. And by the way, he's saying this all as a professional, so you really need to go see a professional when you're trying to work through these things. It's not one of those things that you like read something off Wikipedia and you'll solve it for yourself. That's not what we're saying here. Once again, we are here with Dr. Mason Turner. He's a psychiatrist with Kaiser Permanente. We're talking about holiday blues and depression. And if we can just circle back around again, we know that for a lot of you, this is a very stressful time. There's a lot of stuff going on. There's a lot of people to see. There's a lot of things to do. And I think the main thing we're trying to tell people is it's okay to feel that way. It's okay that you're having these feelings. The idea is that address them, right?
That's correct. And I'm glad you brought that up as well, because oftentimes we do try to run away from depression and anxiety. And I think just recognizing, why we feel this way, but that it's also okay to feel this way, that's really an important first step in dealing with some of the stigma as well. Now, of course, you don't want to kind of live there and live like you have to live in the depression and anxiety state, but really recognizing that it's okay to feel this way and that there's help available is really important.
Now, if people want to read up on any of these things, or they're listening to you right now and they're saying, I really need to go get myself some help, are there some resources that you'd like to recommend?
Yes, so one of them I'd recommend is actually Kaiser's website, kp.org. We have a vast array of different educational articles, podcasts, and other things of that nature that can really educate you about depression, anxiety management, stress management, and different psychiatric conditions and that type of thing. We also have another website called findyourwords.org, which is a really great website as well that is geared more for family members of those suffering with psychiatric illness, but is a really useful tool in terms of looking at stigma reduction, really trying to understand how you speak to someone with depression and anxiety as well. So those are two, I think, important resources to recommend.
Okay, very cool. And they can just go right now and go
Correct.
look. So
Correct.
go look it up. Dr. Turner, we're actually almost out of time. I can't believe it. Was there anything else that you wanted to discuss with regards to this subject?
So one other topic that I would really put out there, that oftentimes during the holidays, we're going to a lot of holiday parties. And we all know what goes with holiday parties, which is alcohol. And oftentimes during the month of December, late November and December, and early January, we are drinking a lot more than we're accustomed to. And so one of the messages that I would give to the audience is that you really want to watch how much you drink during the holiday season. We know that alcohol serves as a depressant in some cases, but there's also rebound anxiety that occurs after you quit drinking. You just really don't feel well after you drink a lot, particularly if you're not used to drinking that amount. So just watch your alcohol intake during the holiday season and the food intake as well. So a lot of fats, a lot of sugar.
Don't eat your feelings.
That's right. Don't eat your feelings. That's right. So just kind of watch how you're imbibing things over the holidays. That would be an important point to bring it out as well.
All right. Very nice. Dr. Turner, thank you so much for stopping by. I appreciate it. Once again, Dr. Mason Turner is a psychiatrist with Kaiser Permanente. We thank him very much. And we hope that your holidays are going to be good and well and fine. And if they're not, don't worry. There's hope for you.
That's right. And thanks for having me.
No problem. Thank you so much. This is Devin for Hawaii Matters. Until we see you again, aloha no, ahui ho.